Okay, combat immune challenges naturally. Hi, I'm Dr. Thomas Kappas. I'm a practicing chiropractor. I've been in practice 32 years. Um, I have taken numerous classes and seminars in natural health and functional medicine, and I hope this information is of benefit to you. What is functional medicine? Functional medicine is often referred to as the future of healthcare, yet it's still widely unknown what sets this practice apart from conventional healthcare provided today. The main differentiating principles of functional medicine include the model of personalized care, a focus of causes of discomfort versus the symptoms, and a deep-seated trust in the individual's body to self-regulate. Functional medicine is revolutionizing the medical field by empowering patients to better understand the imbalances in their body, how these imbalances affect their health, and solutions available to support the normal healing mechanisms within their body. Above all, the functional medicine field helps redefine how we think of disease by providing a more productive framework to achieve optimal health. The Webster Dictionary defines disease as a condition of a living animal or plant body or of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. The current healthcare model is disease-focused indeed. You feel sick and therefore you go to a doctor for a prescription to address the symptoms related to your disease. You are then told you are healed because your cough is gone and the nausea has subsided. Does this sound familiar? This is great for short-term issues as you are able to mask the discomfort fairly quickly. However, for more long-term issues, this medical model fails on addressing the real issues of disease. Functional medicine practitioners, however, recognize that disease is the result of underlying causes, imbalances, and dysfunctions of various bodily systems. When thinking of disease as a result from an issue rather than issues itself, treatment can be administered in a way that provides long-term relief, promotes sustainable health, and empowers the patient in their individualized healing process. Autoimmune diseases of the immune system, they manufacture in different ways, but all behave very similar in the sense that the immune system becomes confused and begins attacking the body's healthy tissues, mistaking them for foreign invaders. Due to the fact that of this understanding of these diseases, conventional medicine works to treat the particular organ affected rather than viewing them all for what they are, diseases of the immune system. Therefore, there is no unified branch of medicine for these autoimmune conditions. Instead, patients are given referrals to specialists that are trained on specific organ systems. This strategy, of course, brings patients further away from treating their body's immune system and results in a vicious cycle. It is common for those that suffer from autoimmune challenges to see a number of specialists for each of the symptoms. Some specialists include rheumatologists, endocrinologists, neurologists, nephrologists, hematologists, gastroenterologists, dermatologists, physical therapists, etc. While these professionals provide an important service and are adequately knowledgeable in their specialty, there is a good chance that they are not equipped to address the need for truly supporting the immune system. Autoimmune disorders come in different forms, including type 1 diabetes, rheumatoid arthritis, lupus, MS or multiple sclerosis, inflammatory bowel disease, Guillain-Barré syndrome, psoriasis, Graves' disease, Hashimoto's thyroid thyroiditis, vasculitis. All of these immune disorders have two things in common. The immune system is not functioning properly. Formal diagnoses are required to receive conventional medical treatment. Fortunately, functional medicine doctors do not wait for the label to begin combating the autoimmune challenges. As functional medicine practitioners take a holistic approach to healing, we offer comprehensive health assessments and collect numerous data in forms of personal and family medical history, genetic makeup, urine analysis, saliva testing, blood tests, nutrient profiles, allergy testing, stool analysis, adrenal stress profiles, hormone testing, environmental factors, mind, body elements, and many more. Administering an array of diagnostic tests provides us a greater range of information to best assess any disease in your body. According to functional medicine, the most common root causes of autoimmune disorders include excess inflammation, a weakened microbiome, intestinal permeability, chronic infections, oxidative stress, food sensitivities, exposure to toxins. With these identified, it's easier to assemble an approach to combat these challenges naturally and holistically rather than just temporarily masking the symptoms. Various stages of functional medicine doctors use to battle autoimmune imbalances include addressing inflammation, dietary changes, gut healing, supplementation, detoxification, physical activity, infection treatments, stress management, relaxation techniques, and many more. To be best prepared to combat autoimmune complications, it's important to understand the role of inflammation in the body. Inflammation is a vital immune response. It's the body's attempt to defend itself against pathogens, heal from an injury, and repair damaged tissue. Chronic inflammation, however, can worsen the body's ability to recognize foreign invaders and put your body on high alert for prolonged periods of time. This can cause lasting damage and the autoimmune response that leads to the body attacking its own healthy tissues. Inflammation can be caused by a number of things, many overlapping, but with factors thought to cause autoimmune issues. Up next, we will be discussing different ways to address inflammation of the body and in turn, combat the common challenges associated with autoimmune disorders. The gut microbiome is an ecosystem of organisms, including bacteria, yeast, fungi, viruses, and protozoan throughout the digestive tract. Most importantly, it is home to 80% of our immune system. An imbalance in the gut bacteria or an increased permeability of the intestinal walls, also known as leaky gut, is both known primary causes, if not a prerequisite to development of autoimmune conditions. These issues contribute to inflammation and in turn worsening the autoimmune responses. Thanks to Jeffrey Bland, PhD, and his colleagues at the Functional Medicine Institute, the 4R program was developed, which provides an effective and complete way to address and treat gastrointestinal dysfunctions while achieving optimum health and digestion. The first step is to remove the possible irritants, including inflammatory foods, toxins, and low-grade infections. There are many ways to recognize the culprits of your discomfort. Food allergies can be determined by skin or blood testing. Food sensitivities are best identified by taking part in a comprehensive elimination diet. It is recommended to avoid common gastric irritants, including caffeine, alcohol, non-steroidal anti-inflammatory drugs, NSAIDs. Stool analysis can uncover uncover potential infections caused by parasites, yeast, or bacteria. Tests for heavy metals in the body can be done via the blood, urine, hair, or nail analysis. Once you're made aware of these things irritating your body's natural digestion, you can begin to gradually removing them to allow your body to regain its natural rhythm. We guarantee that you will already begin feeling the difference after completing step 1. Once we're confident that the antagonizing foods are no longer part of your diet, infections are identified. So basically, you're clearing out the muddy water. And various toxins are removed. It's time for step 2, replace. Step 2 refers to replacing the factors needed to optimize your digestion, such as digestive enzymes, essential fiber, vitamins, minerals, and acids. Digestive enzymes are often found in a pill form and work to enhance digestion, nutrient absorption, and intestinal repair. Your nutrient needs to be determined by lab testing and provide you with personalized results regarding any vitamin and mineral excess or deficiency. They can be addressed by diet change or supplementation. Step 3 is all about restoring the balance of the gut bacteria. A proper balance of healthy bacteria flora in the gut is crucial for immune activity, mood stability, weight management, disease prevention, communicating bodily changes. A way to repopulate the much needed healthy bacteria by including probiotics and prebiotics in your diet. Up next, we'll be discussing the differences between prebiotics and probiotics, as well as common foods that you can include in your diet to reap the benefits of them. Probiotics live in are live bacteria found in foods such as yogurt, kefir, sauerkraut, tempeh, miso, kimchi, and kombucha. They promote a healthy balance of bacteria throughout the digestive tract and aid in the battle against many gut-related chronic illnesses. Prebiotics are a type of plant fiber, and they act as food or fertilizer for the probiotic bacteria. In short, prebiotics are needed to help probiotics stay alive and thrive within our systems. Prebiotics can be found in many different foods such as artichokes, garlic, onion, asparagus, wheat, apple, and legumes. Probiotics are not just for the gut. I've taken and made this slide to show the different areas that probiotics can influence. This slide actually shows how to choose the proper probiotic to combat whatever we're looking to combat. And you can basically click above the icons above and select the probiotics that are appropriate, that fit your needs. Last and most important step of the gut's restoration is repair. Chronic inflammation and stress can severely compromise the lining of the gut. When not addressed, this leads to future autoimmune challenges and nutrient deficiencies. Eating foods high in zinc, L-glutamine, vitamins A, D, C, and fatty acids and antioxidants support the functioning and restoration of your gut. Up next, we'll be spotlighting how some of the most important aid in combating autoimmune challenges. Supplemental nutrition. A few of the most important nutrients those suffering from an autoimmune disorder include the following: vitamin D, zinc, glutathione, omega-3 fatty acids, and the next slide, I've actually included the actual nutraceuticals that we use in our practice to actually have a profoundly positive effect on the immune system. And basically, there are bio-DK caps, bio-FCTS, bio-C plus, and GI Resolve. In order to order these products, we've included a link, and you just click on Campus Wellness Center and Back in Action Physical Therapy Products e-store, and that will actually, it's this link right here, and that will bring you right to the e-store in order to help you select the particular products for your condition. Maintenance phase, a whole foods diet. Autoimmune complications develop over a short period of time, just as the healing process is not completed overnight. As you begin to uncover the causes and make the appropriate changes, lifestyle changes, it is important to implement dietary adjustments to ensure you sustain your optimal health. For example, if foods such as gluten or dairy were found to be causes of inflammation, these foods need to be permanently stay out of your long-term eating habits. However, once you've combated inflammation and strengthened your immune response, your body may react very differently to some foods and that were once bothersome. Unfortunately, we cannot give you a specific diet plan as everybody's needs are incredibly different, but a comprehensive elimination diet can uncover your body's needs, intolerances, and reaction to certain foods. It's imperative that you remain on the elimination diet for at least 21 days and work to repair your gut before beginning to reintroduce possible food irritants. Detox toxins. We are exposed to many toxins on a daily basis, whether it's pesticides on our foods, pollutants in our air, water contamination, or chemicals in household products. Our bodies are absorbing, breathing, ingesting these toxins constantly. In order to reduce the toxic buildup, you must prevent your exposure and detoxify regularly. Prevention methods include water filters, air filtration systems, organic non-GMO foods, and toxic-free household items. Detoxification methods include proper nutrition, ample hydration, fasting, sweating, and exercising. Stress management. Stress and disease go hand in hand. When stress is not managed properly or at all, the body takes the load, becomes inflamed, and often develops or worsens autoimmune conditions. Everyone manages their stress differently, but here are some ideas to include: deep breathing, exercise, massage, meditation, creating art, spending time with loved ones, going outdoors. Please share the most valuable piece of information you've learned from this webinar, and let us know at Campus Wellness Centers or Campus, Kappes WC at hotmail.com. Also, if you feel you'd like to need support on your journey, please do not ask for help. Don't hesitate to ask for help. You can call our phone number at 410-208-077 to schedule an appointment. We hope that this information has exceeded your expectations and that you feel well equipped with knowledge and resources and tools to finally combat your autoimmune challenges naturally. I just want to thank you for spending the time with us, and we enjoyed our time sharing with you.